that the awareness on Peyronie's disease has been missing. It behoves that when I get to see few patients every day and many of them every week who come at different levels of capability, performance, and the stages of disease in Peyronie's disease, it is important for us to spread an awareness on the aspects which people may miss at times. Number one, many of them come with an acute onset problem where there is a pain in the organ, pain in the penis, and the pain is not resolving. The pain is during erection or the pain is without erection. Sometimes it worsens with erection. And this is an acute last few days to few weeks. It worsens and they are therefore finding themselves at the other end of incapability from whatever they were. This could be an immediate, early, acute onset start of Peyronie's disease in few patients. Not that all pain in penis could be because of Peyronie's disease, but this could be one aspect. Pain in penis could also be because of thrombosis, could be because of priapism or persistent erection, which is not gratifying. It could be because of a penile fracture. But acute onset pain, which is progressing and which is disabling oneself both during non-erect and erect states in either of them and worsening with passing time, could be taken care of by an andrologist, something which I and our colleagues in Coquelin Hospital in the Department of Urology continue to see. It's a common phenomenon. So men don't know whom to go to and men don't know what is it for, and many of them may take analgesics or painkillers, which may not be the right therapy. Patients with acute to chronic phenomena may have gradual improvement in the pain, but may probably present with something very new. Present with an erectile dysfunction of a progressive recent onset. And an examination by your andrologist or urologist would pick it up and identify that there's a change happening which was picked up by them. And now I find that there is a plaque. So the question goes on, do you have a good erection? Do you have a penile deformity or a bend in the penis on whichever direction? Is your penis a J shape or S shape, or it's taking a curve which is not letting the manhood happen to be able to do a successful penetrative intercourse or a coitus? And men do complain of that. They continue to adjust in postures. They continue to adjust with life. They also continue to adjust in agony and dismay and disgust, not knowing whom to go to and in shame, with the morale going down that my organ is shrinking, my organ is in pain, my organ is bent, and something which is so common. Of the two people whom I saw today morning, one of them had progressive pain which was only worsening, and with attempted therapies which were done was not giving him a relief. The other gentleman whom I saw carried pictures, which I always request patients of Peyronie's disease to carry, of their best possible erection. And he had a double curvature, a curvature and a curvature. There was a curvature here, there was a curvature here. So double curvature, making it almost progressively impossible for him over the last 7-8 months, as he described, in his 40s, that he is not able to penetrate. And he finds it very difficult when there's an erection. Obviously, in a non-erect shaft, he feels comfortable, but an erect penis is difficult. So friends, Peyronie's disease awareness is quite missing in the society. The reason we continue to see more and more amount of Peyronie's disease is the goodwill of patients who continue to do well. So therapy and cure is ingrained in the awareness aspect on men who are going through a trauma. The bend of penis and directions, which is not straight other than a mild tilt, is something which renders them almost incapable at times when they need to be most capable in bed with their partners. And this is not a disease of old age. This is a disease of young men. People in the late 30s, 40s, 50s, and 60s have presented with various kinds of formats and have found that their penis is either shrinking and they find themselves incapable. They have an early morning erection which is gradually lost, almost completely gone. They have got a palpable hardness in the penis which they can sometimes feel and come over with that. They come with pain or a progressive pain or a pain which was there has disappeared completely, but the erection has gone or the erection has become bent. So there are so many presentations which people with Peyronie's disease do come with. Some people come with a plaque or a palpable deformity. By the same time, the erection is completely lost. And in those patients, we may have to do a combined procedure of putting a penile prosthesis on one side and also looking at straightening the penis by working on a corporoplasty, which we do with bovine pericardium. So looking forward to an organ which is gradually getting disabled, where a male morale is gradually going down, needs to be brought to the awareness of society, especially men who continue to suffer in their partnerships and don't know where to go to. So as your andrologist in your city is capable enough of handling this, because we get a lot of referrals from various andrologists, urologists in the city and country who may not be doing this as a passion, not be doing this as a curative therapy, because they may be busy with many more aspects of urology. But when we look into this very niche area and we look at hand holding the journey for many men who go through erectile dysfunction of different kinds, this is one such aspect called Peyronie's disease where men don't know whom to go to and when to speak. They live in agony, they continue taking medicines off the counter, they attempt their therapies, they continue to fail. And probably at one point of time, they come in or their partners come in or they come together and probably tell us that this is beyond a point in time where we need a cure. Obviously, the medical management of this in the early days could help us stabilize, but progression is almost inevitable. Men who land up with disease also land up with cure. And that's where this awareness is to give a cure and a therapy on people who have got disabled, on people who have had Peyronie's disease. And I get to see Peyronie's coming in from different parts of the country and the world, where people have gone through procedures, gone through tests, gone through therapies, and nothing has worked. We know that the injection therapy into the penis is not the curative therapy. Many times in acute disease or in acute kind of scenario when there's a lot of discomfort and you are in agony, your colleague, uroandrologist could probably do injections of steroids and Kanakot to help you out. That may give you a temporary relief, that may probably take care of the acute onset or the acute progressive change that has happened around. But will it probably give you the cure and the end result is difficult to say. So going by the evidence, going by the results, going by the past therapies, and going by the success stories of many men who have really become men and male and are capable back to the strength that they were having in the yesteryears and have got back to results. I think it's time to put this awareness directly to the society, to all men and to all couples and to partners who have got erectile dysfunction, who have got changes happening in the penis where we can straighten up the organ which is bent. And to just give you an example, a bent organ could be bent for multiple reasons, and one of the bend could actually be cured. If somebody has a bend in the penis of this kind, or somebody has a bend of the penis in this kind, where the erection is looking like bent, can be straightened up completely, the way we straighten up this penile processes, which many a times is implanted in the penis in erectile dysfunction of the refractory kind. So to give you an idea, the penis is an organ which gets an erection where you have a turgidity and a hardness which lets you capably perform, can undergo a change with a plaque formation or a scar formation, which may undergo a bend. And that bend may probably be progressive. A progressive which you hope that it could reverse on its own does not happen. I see it more frequently in diabetics. I see more frequently in men who may not be knowing that there is a facial kind of change happening in the plantar and the palmar fascia, and similar kind of change can happen around. And men may come with various kinds of bend upstairs, bend downstairs, bend towards the perineum, bend in different angles, and that probably could be straightened up by what we now do as called as corporoplasty by way of bovine pericardium repair of the organ, where we don't shorten up your organ by just looking at tightening it up, but lengthen it by opening the concave side and then repairing it completely in a very watertight fashion, which keeps you thereafter capable enough. So I was only giving you an analogy, and this was an analogy with the penile processes which are used so frequently, the tube, which helps me to probably get the hardness and rigidity in men who have lost their hardness around. So Peyronie's disease may present with loss of erections, absent erections completely, and with a plaque, or may present with erections which are bent and deformed, which is not letting a couple being able to conceive, able to control themselves and be capable enough in the bed as they always were. So it's an awareness drive, an awareness which makes many people reach their andrologists in various cities. While we continue to see at Kokilavan Hospital people coming in from various cities being referred by the urologist and coming in after seeing these awareness drives. So I wish them good luck, and I wish all of them good luck in terms of getting well, getting cured, and permanently cured.